Okay, so I'm sorry if I'm not making eye contact. This is a traveling office. It's about 8:30 p.m. It's Friday night. Today was a really long day at the office. Very, very gratifying day. We had 6 new patients today who transferred from other rheumatologists because they weren't getting better, and myself and my staff, and I speak for my very loyal and very devoted staff of many, many years, decades for some of these people. Really strong effort today. I gotta give it to them. Between Denise and Peg and Tim and Dana, they all know I can't do it without them. Okay, so today we're talking about hypermobility and dysautonomia. And it was pointed out to me that the last lecture I did on here for hypermobility and dysautonomia, in fact, was probably at the level more for a doctor than for a layperson. So what I'm going to tell you about right now are the things you need to look for if you are a hypermobile or patient with dysautonomia. And I want to start with dysautonomia. So first of all, the autonomic nervous system to you should be the automatic nervous system. It controls your blood pressure. It controls whether your blood vessels are open or closed. It controls whether you breathe when you're sleeping. It controls whether food moves through your body after you eat it. It controls goosebumps, sweating, anxiety, the fight or fright reflex. It controls basically anything that you're not aware of that's just always happening. So you should look for persistent nausea and trouble having food go through your stomach and small intestine and colon, because you can have gastroparesis, you can have colonic inertia, you can have, rather than rapid transit, you can have slow transit. Any of these things, while of course they're common in diabetic neuropathy, which itself is really an autonomic dysfunction, they can happen primarily in a primary dysautonomia. So look for those things. Okay, that's one. You want to look for dry mouth leading to dehydration, leading to the blood vessels opening up because the nerves loosen on them, which will drop your blood pressure, speed your heart, and you pass out. This is another way of describing POTS, P-O-T-S, which stands for Postural Orthostatic Tachycardic Syndrome, which means it's based on your posture, your change in blood pressure with your position, which will lead to the rapid heart rate, drop of blood pressure, and passing out. Okay, that's something else. Regarding the hypermobile portion, sprains, dislocations, thin-skinned scars, so-called cigarette paper scars or wax paper scars, nearsighted, young women with glasses who are nearsighted, they also will have bruising easily. So what they have in common is things are loose. So your lungs can be loose, you get a collapsed lung. Your ligaments are loose, you sprain your ankles, you roll your ankles click, your hips lock, your shoulders click, your shoulders lock, your knuckles crack. You get hernias, you get diverticulitis or diverticular disease, you get collapsed lungs. I'm certainly leaving some things out. I'm not trying to be encyclopedic. In fact, I'm actually just missed a spam phone call from who knows. Anyway, so you got me here from the mobile office the mobile office of Dr. Soloway on Friday night, reaching out to his wonderful patients. So I hope you all learned something here and benefited. And to the 5 or 10 people that are on my back about doing a lecture on Still's disease, I promise I will do a lecture on Still's disease. You have my word. I'm trying to make it a good lecture. It's a very complicated topic. I can answer specific questions, but I'd like to do it in a fashion that, one, you'll understand, and two, I'll feel like I actually explained what I needed to. But maybe I'll give you a short little 2-second lecture on it briefly in a few minutes. How's that sound? Sound good to you? All right, sounds good to me. Don't forget to click the bell, and don't forget to like the video. Don't forget to subscribe so you can see all the new videos that come along. Don't forget to share with your friends, and don't forget to stay healthy and have a great weekend. If you get a chance, get out there, exercise, enjoy yourself. And although wait, today is raining and tomorrow is supposed to rain, so do a rain check and do all the good things next weekend. All right, signing out from the spaceship Soloway.